Information and opinions expressed during the related show are those of the show personalities and guest alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Ant2.tv 717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. We are a certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. You can reach us directly at 954-717-7027. I am your host, Louise Gomez. Welcome to the show. And today we have Dr. Zaki Moyenda, which is he has Moyenda Medical Associates, board certified in family medicine. The address is 220 South Dixie Highway, Lake Worth, Florida, 33460. Phone number is 954-774-1414, and it's moyendamedical.com. Thank you so much for joining us on the show, Dr. Moyenda. We'll be getting him. I guess he's coming on. Oh, hi. How are you, Dr. Moyenda?
I'm well, thank you. How are you?
I'm doing well. Thank you so much for taking time out of your busy schedule and joining us on the show. I wanted to say I appreciate that.
Thank you very much. It's always an honor and pleasure to be on. I want to thank everybody at All County as always. I think this may be our 5th time on, and we're very grateful for the exposure.
Thank you so much. So, Dr. Moyenda, can you tell our listeners just a little bit about your background, your training, your experience, where you went to school, fellowship, residency?
No fellowship.
Or whatever.
Yeah, I'm board certified in family medicine, as you mentioned.
Okay.
Family practice, primary care provider here in Lake Worth. Did my residency at Meharry Medical College in Nashville, Tennessee.
Okay.
And I've been practicing here in South Florida for about 9 years, hospital medicine, and as you know, branched out into our own office last August. So we're about midway through our first year of operations.
Wonderful. And Dr. Moyenda, what is the age range of patients that you see? I know you're family practice, but can you give us an idea of maybe the range of the ages?
Yeah, primarily adult medicine. You know, we do routine things for children and adolescents, but primarily adults 16, 18, and over.
Okay, wonderful. And what types of insurances are you accepting at the practice?
Well, currently we are proudly accepting all the Blue Cross Blue Shield products. We have Medicare and Medicaid, of course, and we've recently, since the last time of our airing, we since got with Cigna and Aetna commercial plans, and we're also out-of-network benefits with Humana and United.
Wow, that's great. So a wide range of insurances. So I'm happy to hear that. A lot of people will be wanting to reach out to you for sure. So what are your areas of interest? Because I know you've seen it all and you've experienced so many different cases of different people, but what is it that interests you when you see a patient?
Well, let me go broad picture. Our
Please.
areas of interest are excellent primary care service, delivering the best quality care we can to each and every patient that comes through the door, treating them with respect and courtesy, not just as a slogan, but in real time. So clinically, I'm interested in the bread and butter of primary care, which is hypertension, dyslipidemia or high cholesterol and the sequela that goes along with that, and diabetes, of course. Diabetes is probably, I would say, my most favorite clinical interest because it's one of the few chronic diseases that we can actually jump on top of and make a big difference in the quality of people's lives.
Yeah, and it sounds like to me maybe some of those things are they lifestyle related? Is there something that you speak to them about lifestyle modifications or what would
Absolutely.
yeah, can you
Yeah,
speak into
for sure.
that? Thank you.
Yeah, for sure. When we look at most diseases, most of it is sort of self-induced by what
Mhm.
we eat and what we put into our body in terms of all kinds of toxicants, processed foods, and the like, and sometimes just eating too much in terms of portion and lack of exercise and the like. So, that being the cause of many diseases, when we go to the source of that, sometimes we can manage diseases such as diabetes medically. We have a few patients in our office who have been diagnosed with diabetes, and due to their commitment to changing their lifestyle, we've opted to treat them without jumping on medications. Of course,
Mm.
sometimes if it's too out of control, we
Sure.
need to augment the therapy with pharmacotherapy. But we try not to push pills recklessly, and we try
Mm.
to be very targeted in our approach with the outcome of uh, with the outcome of beating the disease and at the same time improving a quality of life.
Well, I have to say that in and of itself makes your practice quite unique and special because you just said you don't necessarily jump on prescribing the medication because as you said this is a something that possibly can be, improved through lifestyle. What would you say to somebody who maybe they're a little overweight. They think they may have sugar challenges and maybe they're sitting at home listening to this. What would be the first step? Because some people are a little fearful. What would be the first step for them to, to go and see you? What would that experience be like?
Well, we always take each patient individually. We don't
Mm-hmm.
see the patient as the disease. We see the patient as the patient who happens to have the disease, for starters. And
Mm-hmm.
then I like to take a systematic approach. Some patients have multiple problems that weren't created overnight, so they're not going to be solved necessarily overnight. So we
Mm.
want to tap into the mindset and find out exactly how motivated they are or how dismotivated they are. And there's a
Mm-hmm.
psychosocial component to it as well. Some patients need motivation. It's our job to motivate them and see them through the process. And so I like to talk about that as I get to know the patient. But again, we like to take a step by step process, not introducing too many medications at one time. Sometimes the patient had just been diagnosed. So that
Mm.
itself is something that needs to be digested and
Yes.
absorbed before we just start throwing a whole bunch of medications onto their plate. And sometimes not having taken any medications at all for years, some
Yeah.
of these medications you have to take twice a day. So we
Mm-hmm.
have to understand that people, it's not normal to take a medicine once a day, let alone twice a day. So ultimately, we want to improve compliance and adherence to the treatment plan, and we do that by education, motivation, and frequently coming back into the office, and that helps motivate them if they can see the progress from day one through, say, week 2 or 3, and sometimes after the second month, and they can see the progress that motivates them to go on to the next step. So we take it step by step with each patient, treating them accordingly to their current situation, whether it be financial, employment wise, their motivation, etc.
You know, Dr. Moyenda, I really appreciate that because it sounds like you're doing a more personalized type of individualized type of medicine. And I'm sure you hear from a lot of your patients, a lot of us complain and we say, oh God, we feel like a number and we're in and we have like 3 minutes to talk. But from my experience already, I can already tell that you're definitely more personalized and you're doing it more on a holistic level because there's so many other components that a tribute to their to our health, right?
Correct.
Mm-hmm.
And we all are challenged by time. Time is very fleeting for everyone. So one of the things that they don't necessarily teach you in medical school or in residency training, we sort of have to learn on the job, is how to be quick and efficient and
Mm-hmm.
explain very complicated things in a very concise fashion in such a way that the patients can understand it and really absorb it. So that's sort of the trick of the trade we learn from experience, but nonetheless, it goes a long way in saving time on the back end. If we could spend initially the first visit on education, getting to know the patient and letting them feel comfortable, because that's also important to get
Mm-hmm.
into the social history. Because the more we talk to the patient, the more information we get. Sometimes we go too fast.
True.
Patients either forget to say something, or they feel too intimidated. The walls are up, and
Mm.
they feel like we're the police and we're going to judge them, etc. So we want to
Mm.
make them very comfortable. Again, with the end mind, with the end goal in mind of betterment, wellness.
I love that. I think that's really what people are looking for nowadays. They want that more interaction, and it's definitely evident that that's what you're doing at your practice. So that is definitely welcomed. Dr. Moyenda, can you just tell us a little bit more about your concierge services and maybe your office hours so people can get a better idea if they want to, get in touch with you? What are your hours and whatnot?
Absolutely. We are open Monday to Friday, 8 a.m. to 6 p.m., and Saturdays from 8 a.m. to 2 p.m.
Mm-hmm.
And so we offer extended hours in the evening.
Mm-hmm.
And that's very convenient because, as you know, in our economy, a lot of people have work to do, and taking time off sometimes can be very challenging for them. So we try to make it convenient for them. And we also do telemedicine, virtual visits, and the Saturday
Nice.
hours we find are very convenient for our patients. With respect to the concierge component of our practice, we have yet to really fully market it, but we have a few patients who don't have insurance,
Mm-hmm.
but have jobs and they're employable. So that our rates are very affordable. And so
Mm-hmm.
we don't want to let finances be a barrier to patients getting the care that they need. It's very, very important. Urgent care is very expensive. A lot of
Mm-hmm.
times you won't actually be seen by an MD.
Mm-hmm.
The emergency room, of course, is not the place for primary care. Absolutely not. But we
Right.
find that the emergency rooms have traditionally, over the last 15 to 20 years, been serving as the primary care center for a lot of people. And that's just awful medicine.
Mm-hmm.
So we have a concierge service with very affordable rates for people who can pay by the year, pay monthly if they need to, and get the labs that they need in an all-inclusive price, get home visits, and get 24/7 access to me directly through texting and phone visit, virtual visits, and the like. But we'll be marketing that a little bit more as we grow.
Mm-hmm. Um, can you tell us a little bit more about some people have never done telemedicine. What kind of experience would that be like, and who should use it, and um, what is that like? I know I have not, and I imagine some others have not. So maybe you can share a little bit more. What does that
Well,
look like?
telemedicine is sort of been around for some time. Of course, it launched and exploded exponentially during the
Sure.
COVID pandemic.
Right.
But beyond that, it's very useful for patients who are super busy and don't really need to actually physically be in the office. It's also beneficial for patients who are homebound and are not able physically to get out to the office. Again, it goes on a case by case basis, and
Mm-hmm.
we would interact similarly to how we're interacting now. There's a battery of questions that every physician knows what to ask and sort of can nail in what the diagnosis is or what the problem is. I think where we differ is that I'll actually go out to the home if I need to, and I've done
Wow.
home visits for patients. And actually, I tell everyone that's the best part of my job. I actually don't get a chance to do it that often. But we actually do go out to people's home one on one and meet with them with our
That
bag, take their vital signs, sit down with them, go over their medications,
that's
physical exam, and
impressive.
the like.
That's so impressive, Dr. Moyenda. We're going to take a quick commercial break. When we come back, we're going to discuss a little bit more about all of your services that you offer and what a great job you're doing. So we're going to take a real quick commercial break, and we'll be back in a minute. All righty?
All right. Thank you.
Okay, thanks.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back to You and Your Doctor. We have Dr. Zaki Moyenda right here in Lake Worth. It's Moyenda Medical Associates. He is board certified in family medicine. You can find him at 220 South Dixie Highway, Lake Worth, Florida, 33460. Phone number is 954-774-1414, and that's moyendamedical.com. Welcome back to the show, Dr. Moyenda.
Thank you very much. Thank you.
So I'm really thoroughly impressed because from what I'm experiencing from you, maybe because younger generation, you seem younger. Maybe this is more of a common thing that you're actually saying you go or you've been to the patient's home for a home visit if necessary. That's going above and beyond the call. So thank you for doing that. I'm sure your patients appreciate that. I don't know. Go ahead.
Our profession is quite an honorable one. It's very unique, very different. The hours are different. The training is different. The expectations are different. The liability, everything is just a very unique profession. And we honor it because patients would otherwise not reveal themselves to a stranger, right? So they come into us with full trust that we're going to take their information, their personal, very personal information, do well by it, and make them feel better. So I think the very least we can do is give them the best service we can do, and we take that very seriously. Our slogan is our patients are priority one.
Our patients are what? Say that again.
Priority one.
Oh, I like that.
And for someone who's been working in the hospital industry for some time, we don't always get to see that level of quality, unfortunately. And the excuses range from the time we have to spend with them, the nursing staff shortage and whatever. But I think the patients are quite fed up with these excuses. And they really want to, they're driving the market back to what medicine is supposed to be like. And that is take care of the patient, do what we're trained to do, and let everything else fall, where they may fall.
Well, it definitely shows. Can you share with us maybe a couple of, or maybe an experience that you've had with a patient where, they came in presenting with something and then you've guided them through their experience and they've taken the initiative and your suggestions and they've had a successful outcome. Is there anybody that stands out, any particular case that you can
Absolutely.
share a couple of details, not too much, but maybe. Thank you.
Yeah, we proud to say again. We had our grand opening on August 10th of 2022. So
Okay.
we're within our first year, and I can proudly say we're over 100 patients in our panel currently. And
Nice.
we've certainly had some success stories already. Again, we go back to diabetes because that's something that I'm particularly interested in. And
Mm-hmm.
we've had patients. There's a lab test called the hemoglobin A1C,
Yes.
and that's a blood test that sort of gives an idea. It sort of diagnoses diabetes, but it also gives a snapshot to how controlled or uncontrolled a patient is with their disease process, in this case, diabetes. So
Mm-hmm.
we've had patients come in ranging from A1C levels at 7 all the way up into the double digits. And so, because this is something I'm interested in, have some knowledge of, I'm able to explain to them, number one, what is diabetes, and that itself is empowering to the patient.
Mm-hmm.
And we've had patients, again, we're managing them medically. So if there's some obesity, central obesity in place, then we
Right.
set out an exercise plan for them. Of course,
Mm-hmm.
diet is going to be something that's very important. And I always like to scare them sometimes. Insulin is not a death sentence, but a lot of people think it is. So I say, okay, well, we want to stay away from insulin. This is what we can do. And so
Mm-hmm.
we give them a glucose log to monitor their glucose levels. We
Mm-hmm.
teach them how to check their glucose levels. A lot of times, remember, this is a brand new diagnosis. So
Right.
you can't just leave the patients on their own and say, okay, take this medicine, see you back next month. That's
Right.
not the way we do it. We give them, sometimes we've even bought glucometers for our patients
Wow.
and show
Nice.
them how to do it. Get the test
Nice.
strips and make sure it's calibrated. So we go
Mm-hmm.
through diabetes education. We do a lot with them. We tell them the importance of checking your feet and in the web spaces. As you know, diabetes uncontrolled will lead to amputation. So we let them know you should see a podiatrist. I actually
Mm.
share office space with a podiatrist.
Oh,
So that
nice.
often, that often helps. And the importance of getting their diabetic retinal exam annually. So all this information, again, we don't throw it all at one time.
Mm-hmm.
We just give them a little bit at a time. If we see that they can absorb it, we give more. But the point is, we've had people, and they get excited. They come back with their blood sugar logs, and they'll say,
Nice.
"Oh, look at his numbers." And so it was,
Nice.
180, or it was a little high. And we say, "Okay, this is what we need to do." And
Mm-hmm.
so we find that this transparent, open, clear communication is very, very effective. And that's why I tell my colleagues, you may think it's a lot of time we're spending that you don't have, but if you don't
Mm-hmm.
spend it on the front end, trust me, you're going to spend it on the back end.
Mm. Very true. We have 2 minutes left, Dr. Moyenda. Can you just share what tips and tricks, or what would you suggest for somebody who's listening, and they want to take the first step in a healthy lifestyle? In 2 minutes, you want to maybe give us some tips and share? We appreciate that.
Well, the first thing you can do is pick up the phone and call
Uh huh.
954-774-1414.
Yep.
Make an appointment.
Mm-hmm.
Regardless of ability to pay insurances, we take it as a given. We're in business to make money, but we're also primarily here to treat our patients. So we don't want finances to be a barrier to anyone getting the care that they need. And that's why we offer free blood pressure screenings, because this is another thing that, if treated properly, we can prevent strokes, heart attacks, and kidney failure by treating blood pressure.
Mm-hmm.
So that would be the first step. For those younger people who are on Instagram, they can follow us at Moyenda Medical.
Yep.
We have a good business consultant. I would recommend anyone in business to take a look at Take the Leap Consulting. Take the Leap Consulting. You
Okay.
can Google them and see them. They're a good bunch of folks over there. They help us a lot. We're on our Google page. We have
Nice.
5-star ratings on Google. If you look at us, Moyenda Medical Associates, and see what our patients have said about us, see what our customers, their experience. We're very proud of these reviews because it's a testimony to the hard work that we're doing. So again, if you go to Google and
Yep.
type in Moyenda Medical Associates and take a look at our reviews, so those are a few ways to access into our care, and hopefully you're feeling better.
Yep.
And we can offer tips to make you stay better in terms of our wellness. But if you do have any conditions, call us up. We'll be more than happy to get to see you right away.
Thank you so much, Dr. Moyenda. You've really done a great job explaining, and not only explaining, your energy truly, sincerely comes across that you really do care, and it transmits through the radio and through the radio waves and the TV. So I can definitely feel that. So keep up the good work. Thank you so much for coming on the show, and I hope to meet you one day.
Yeah, I look forward to it. Sorry I couldn't make it today. Time
That's
slipped
okay.
under my feet, but next time we'll be there and say hi to my good friend John Kelly. Also, a big
Thank you.
shout out to him. Very, very supportive, and all the staff there at All County. I mean that sincerely, and he knows that. Very, very, very supportive. We're very appreciative of everything.
Thank you so much, Dr. Moyenda. Enjoy the rest of your evening. We'll see you soon. Take care.
All right. Thank you very
Bye-bye.
much.
Thanks.
Bye bye.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air.